Welcome to training on the regulatory document management to help you comply with federal regulations and international guidelines regarding the regulation or essential documents you must establish for each clinical trial. The objectives today are to introduce you to essential documents required to conduct a clinical trial and introduce you to those sources requiring regulatory documents. So, what are essential documents? Essential documents are those documents which individually and collectively permit evaluation of the conduct of a trial and the quality of the data produced. These documents serve to demonstrate the compliance of the investigators, sponsor, and monitor with the standards of good clinical practice and with all applicable regulatory requirements. Why are regulatory documents required for a clinical trial? Regulatory documents are submitted to track and evaluate the ethical and procedural conduct of a trial and the quality of the data that is produced. Regulatory documents demonstrate the compliance of the investigator, sponsor, and IRB/IEC with the standards of good clinical practices and with all applicable regulatory requirements. Regulatory file document guidelines. Investigators must establish one file for each study. All essential regulatory documents must be in the file. Must be established at the beginning of each study. Must be updated throughout the life of the study. And these are the sources for requiring those documents. I want to show you here, if the key take-home point for this slide right here today is if you can go to this website right here. I'm going to pause here and take like a few minutes for you to take down notes. This is going to be the ICH GCP at www.ichgcp.org. This link right here, and I'm going to go into that link for you, will take you to what is required. These are the essential regulatory documents for the conduct of a clinical trial according to ICH GCP. And you want to go down to, when you're on the website, you want to go down to Section 8. Go down to Section 8, Essential Documents for the Conduct of a Clinical Trial. And it starts right here. And this section right here will tell you everything that's required. It's broken down into before the clinical phase of the trial begins. That's what we're going to concentrate on today. We're going to concentrate on some of the regulatory documents that are required to be conducted before the clinical trial begins. And these are the before phase. Then it breaks down to the during the trial, what are the documents that are done for during the trial, and then you'll have the after completion of the documents. So key take-home point today on this slide is make sure that you have this website written down, and that way you'll know what all the regulatory documents that are required to conduct a clinical study. I also know that all of you are familiar with the old cliche that it's better to ask forgiveness and permission. Please know that this does not apply when conducting and keeping up with your regulatory file documents. It's always best to ask to make sure that you know what you're doing. And there's no such thing as a silly question. So if you have any question about what you need, ask. Call your sponsor, call your IRB, call your contacts, ask what you need to do to make sure that you are conducting and you have the proper regulatory file documents. And also, make sure that during the course of the study that you document it. If you're all familiar with that cliche, if you didn't document it, it didn't happen. So make sure that you document it during the course of the study. Okay, and I also want to let you, this is just as an aside, we had a study that we were conducting in our office, and after 20-something years, we were finally able to destroy our documents. So I just wanted to throw that in there to let you know that all the regulatory documents that you keep, and are so important to make sure that you keep up with them and know when it is that you're supposed to get rid of them. So if you know and I'm going to go over that with you today, we're going to discuss what's required by the FDA, how long it's required by the FDA, how long it's required by your sponsor, and if you don't know, to make sure that you ask your sponsor. So what we're going to talk about, again, like we were just looking at the ICH GCP essential document list in Section 8, is we're going to talk about a few of these documents. Today we're going to discuss a few of the documents that are required. And some key things to remember, and I'm going to reiterate this, key things to remember. Whiteout or correction fluid are not required, are not authorized, are not allowed on your regulatory documents. If it's not documented, it didn't happen, and you never think about asking forgiveness rather than permission. Make sure that you have permission first. And there's no such thing as a silly question. So today we're going to go over, like I was talking about, these documents right here. And they're not inclusive. There are still some more on there, and that's on the list that I've just showed you. So today we're going to talk about, the first document we're going to talk about is a 1572. A statement of 1572 is one of the documents that is required for an IND study. This is a contract between the FDA and the investigator, and it's a criminal offense under the FDA and C Act. I'm sorry, the FD and C Act, and it's only studies that are conducted under an IND, which is an investigational new drug. The statement of the investigator is provided to the FDA via the sponsor. It is agreement signed by the investigator to provide certain information to the sponsor and assure that he or she will comply with the FDA regulations related to the conduct of a clinical investigation of an investigational drug or biotics. Why does this form need to be completed by the investigator? The 1572 has two purposes. It's to provide the sponsor with information about the investigator's qualification and the clinical site that will enable the sponsor to establish and document that the investigator is qualified and that the site is an appropriate location at which to conduct the clinical investigation. And then number two is to inform the investigator of his or her responsible obligations and obtain the investigator's commitment to follow pertinent FDA regulations. Investigators should remember to complete this form as accurately as they can. Investigators should be made aware that making a willfully false statement is a criminal offense. Further submission of a deliberately false statement to the sponsor or the agency can be taken into consideration in a disqualification proceedings. So this is a very important form. Make sure that you fill it out correctly and that you know what the consequences are of making false statements. So, what is the 1572? The 1572, as you all recall, is it's a form that the investigator, what we just talked about, the investigator's responsibilities, and make sure that you have the most correct 1572. There is an old two-sided 1572 that years ago was just a two-sided form. As you can see, this new form can split into 6 different pages. So make sure whenever you're filling out this form, that the best thing that you can do is make sure you go to the FDA website and get the most current form. So where can I find the form? So I'm going to take you here to the FDA website, and I'm going to show you where you would go. So another key take-home place for this would be, make sure that you write down this www.fda.gov. When you go to the FDA.gov, you're going to go to the FDA forms. And then from the FDA forms, you can scroll down until you come to 1572. There's a 1572 on here. There's also a guidance form. So here's a guidance form that tells you step by step how to complete the form. And then here's the actual link to the 1572 itself. You'll click on this link. And then the key take-home point, again, the key take-home point is this. Always make sure that you go to the FDA website to get the most current form. And up here it'll tell you that the most expiration date is 30 April 2015. So make sure again that whenever you're filling this form out that you get the correct form. Some examples of when you would change this 1572. Can anybody think of some examples of a 1572 that during the course of the study that you would have to change this? Okay, since I can't hear you, let me go ahead and give you a couple examples. Some examples of when you would change a 1572 include if there is a change in the PI, if you have a change in the PI, or if you have a sub-investigator change, or if there's an address of the study site, or if there's a clinical laboratory change, or if the IRB changes their address. So again, those are some key things that you can look at of when you would change your 1572. Make sure that your 1572 is current and that you always have the most current information on it. Don't wait for the monitor to come to your sites and say, okay, why is this sub-investigator not on here? Why are they here or not here? Just make sure that you keep up. If you have sub-investigators that come and go, make sure that you keep your 1572 current. Okay? So, here's a helpful hint. If you do add that individual to your 1572, check with your sponsor to see, when you update your 1572, what else do they need when you put that person on there? Well, some of current examples that what we require when you put a update of your 1572 by adding a sub-investigator is the financial disclosure forms, a CV, a medical license, and their human subject protection training. So those are just a few samples of documents that are needed whenever you make a change to that 1572 by adding a new sub-investigator. Okay, another type of document, what we were just talking about then was a 1572. A 1572 is used for your IND studies, for your investigational new studies. There's another type form that's called Investigator of Record or an IOR agreement, and this is used traditionally for non-IND studies, such as your natural history studies or your case review forms and things like that. So I'm going to give you an example of one a little close of this form right here. Again, this is our sponsor form. It's an IND form. It's our form itself, a DMID form that we use. So for non-IND studies, you would use some type of investigator of record agreement, and if you're not quite sure, just check with your sponsor and they can let you know what type of form to use for non-IND studies. Okay, another one of the essential documents that are required are your financial disclosure forms. The financial disclosure forms, again, are for your IND studies or your investigational new drug studies. A financial disclosure form is required for everyone that's listed on the 1572, and this documents any potential conflicts of interest regarding compensation, liquidity, and proprietary information. Okay, delegation of responsibilities signature log. The delegation of responsibilities signature log. This is a form that the principal investigator uses to delegate different types of responsibilities for people that's going to be conducting the trial. So this is a hugely critical form. This is a multi-purpose. Basically, this form lists duties that have been delegated to the PI, by the PI to the study team. All study staff members, including study nurses, staff maintaining regulatory documents, pharmacies maintaining and or dispensing the investigational product, lab staff who will be running specific laboratory tests, and staff entering data on the source documents or the case report forms are listed on this form. This is critical to keep up with. If given the task, they must have the training. So if you're going to give somebody responsibility, delegate it, make sure that you have it in writing that they are qualified by training to do this job. This log provides a link to who is responsible for what and their start and stop dates. Cross-referencing this log with the CVs of the study staff is one way the monitor will ensure that they are qualified to do what they've been assigned to do. The CVs. The CV is another central document. All investigators and sub-investigators listed on their 1572 or your IRR must have a current CV, and that current CV must be in accordance with whatever your sponsor is. Check with your sponsors. Some sponsors want an updated CV every year, every other year, or every 5 years. So make sure that you check with them to determine how current the CV must be and whether it needs to be signed and dated. Some sponsors require that the CVs are hand-signed and hand-dated. So this, again, the CV The CV is for what reasons? It's evidence of qualifications to conduct the trial and to provide medical supervision of subjects. And so, again, it's qualifications that they are required and qualified to do what they're said that they're going to be doing. Another is your medical license. Another essential regulatory document is your medical license. The PI is responsible for maintaining the current license for all sub-investigators and study staff. Maintain a copy of the current medical license for the PI and all sub-investigators listed on the 1572 in your regulatory files. The next thing we're going to talk about is your federal-wide assurance. Your federal-wide assurance is a certification obtained by the research institution. To obtain an FWA number, the institution follows a process and submits an application to the OHRP. This certification signals that the IRB is maintaining its responsibility of protecting human research subjects according to ICH and GCP. So, if you are not quite sure of what your FWA number is or what the expiration date is, contact your IRB. Your IRB will be able to provide you with that number and the expiration date. And another way that you can look up your FWA number is go directly to the OHRP website. You can go to the OHRP website and pull out your assurance, but make sure that when you go to the OHRP website, if you're looking up your FWA number and you want to look up your FWA number, you have to know your number exactly. You have to know what your number is exactly. If you don't know what your number is, you have to know how it's listed in their database. So if you type in something and it doesn't come up exactly like what you think it's going to be, just make sure that you do a few searches. Like, for example, here at the University of Alabama at Birmingham, if I might type in Alabama, well, if I can type, if I type in Alabama, there's going to be a lot of different things. So if I did not know that ours is the University of Alabama at Birmingham was written exactly like that, and I didn't type it in exactly like that, it wouldn't come up. So make sure that you do it's kind of like doing a Google search. Make sure you type in like a generic name that you can get at least to what it can come through, and you can look and see what the search results are, and you can go in and find it. So then if I click on this and I look at the University of Alabama, I know that it expires on 1/24/2017, and then I can print this, and that would be my proof enough to submit to our sponsor that we have an FWA assurance here at the university. Okay, so that's very important. Another key take-home point from this slide is, make sure that you go to the OHRP website, write down that information or highlight it on the slides that's been provided to you, and if you need to provide your sponsor with your FWA assurance, that you can go there and get that. Okay, another thing is the protocol amendments. Now we will discuss this protocol and protocol amendments. And there has been an entire section on the protocol in one of these presentations that you'll go over. But the key take-home point that I want you to remember from this right here is to please remember that all protocol changes must be approved before you can implement them at their site. And make sure that you have your current version number and the version date on your protocols and on your approvals. So again, should your study member also be a member of the IRB board documentation, must be in their file of their voting abstentions from all protocol-related decisions. So again, if you have a board member or if your PI is also on the board, you need to make sure that you have documentation that they did not vote on that board proceedings. That's just a thing to remember there as well. And document. Make sure that you have documentation of everything between you and your IRB. Document, and keep up with it. Okay, consent forms. Again, I'm not going to go over this because you will have an entire session on consent forms, but the key take-home thing that I wanted to take away from this is to make sure that you have your IRB approval. You will have your original consent form that comes back with your original IRB approval stamp on it. Make sure that you maintain that in your regulatory document binder. and that you maintain all current copies, just, like keeping up with the discuss ways to keep copies of the most recently approved consent. So when you go to consent a patient, that you're going to be pulling the most current approved consent document. A lot of people will tell you that that's one of the problems that they have is when they go out and consent a patient that they've got the wrong approval. So just make sure that you come up with and devise a way at your study, at your site, that you can keep up with what the most current approved consent form is. Some ways that people have told us about is they keep their most current approved consent copies of it in a document protector so that they can always go to that and they know where to go to get the most current copies of it. Another way people have done it is with different versions of the consent forms, they just make different colored copies. So if you're got the blue copy, then you know right away that that's the most current one. If somebody comes and they have a red one, then that one is expired with the last one, and everybody knows that the blue copy colored paper is the most current consent form, whatever's most current at the time. So just devise ways at your site how to keep up with it, with the most current approved consent form, so that when you do consent the patient, that you do have the most recently approved consent form with you when you go to consent the patient. Another type of essential documents that we have are all of your advertisements. And again, there's going to be an entire class talking about advertisements and everything, but and ways to advertise and how to do this. But the key take-home point that I'd like for you to take away from this slide is that you must have IRB approval prior to using any of your advertisements. Again, the periodic reviews, annual reviews, and final reports. Again, this is communicate, communicate, communicate. Make sure that you keep everybody informed of what's going on during the course of your study. Make sure that you provide the IRB with copies of everything that's required by their local standards that they're supposed to have. The proof of communication and sharing of information throughout the life of the trial is essential in maintaining the integrity of the data at your site. To document the trial that has been subject to IRB IC review and given approval says favorable opinion, you need to identify the version number and the date on the documents. So make sure that whenever you're submitting something that you have the current version, date of the document there. Because a lot of times you're not, when you start a study, you may start out with version 1.0 of the protocol, and then you may end up with version 5.0. So you need to make sure that during the course of the study that you're documenting what version of the protocol that was approved at the time. You also need to make sure on your consent forms that you have that current version date of that protocol on there so that you'll know at what point during the study you had the correct protocol version approval. Okay, now the next thing that we're going to talk about is our laboratories, the laboratory credentials and certifications. And the purpose of this is to document the competency of the facility to perform the required test and to support reliability of those results. So whenever you're filling out your 1572 and your IOR, and you list on there, you list your clinical lab, you need to make sure that whenever you list that clinical lab that you're going to have the required documentations of the facility. And that's going to be, you're going to hear these common things are going to be called your CLIA and your CAP and your reference ranges. And so what I want to do is just to show you, you will hear CLIA a lot. I'm going to show you, this is what a CLIA certificate will look like. It'll have these little black lines around it up here. And it's called Clinical Laboratory Improvement Amendments. And this is really not what it's referred to. This is what it's called, but it's called CLIA, and you'll hear that a lot. I need to have your CLIA and your CAP, as that's when it relates to your laboratories. And this is the proof that we were talking about earlier. This is the proof that it's to document the competency of the facility to perform the required test and to support the reliability of the results. By having these certifications, then you know that you've got that documented. And there's a couple of things of interest that I wanted to point out to you here. On the CLIA, there's the number right here. This is the CLIA number that's assigned to it, and it has an expiration date on it. So when you'll look right here, so that your CLIA and the CAP relate to each other, I'll show you here. On this CLIA number here, that CLIA number relates back. So that, I'm sorry, for this CAP. This is called the College of American Pathologists. This is the CAP certification. So this right here will say this is the CLIA number that's associated with this CAP. So your CAP and your CLIA are linked together this way as well. So this is something that's kind of interesting when you're looking at it. And also it'll have its expiration date too. Okay? Then again, we're going to talk about some additional documents. Some additional documents that are required because at this point we have reviewed all of the minimum required documents to be maintained in your regulatory binder. There are other documents that must also be a part of the required regulatory documents. And if you wanted to know what the other documents are, again, I encourage you, always go back to your ICH GCP Essential Documents list in Chapter 8. Go back to Chapter 8, and Chapter 8 will tell you the title of the document, the purpose, and the location of the files. So always, again, the key take-home point is make sure that you know where this is, where you can go find it, and it'll help you tell you exactly what is required before, during, and after the course of the study. If during the course of the study that any documents are kept, if any documents are kept somewhere other than your regulatory binder, you should complete a note to file explaining where those documents are located. Some examples of documents that would not be maintained in your regulatory binder would be financial disclosures and patient contact information, because those are supposed to be maintained in a confidential location. So if you have your regulatory binders out, say on a shelf in your office, then you can have a place and behind the tab that just says, okay, my financial disclosures are located in this locked cabinet in this office right here, and also my patient contact information is located there. So you can have it all together with the documentation of where you're keeping the confidential information. Okay, let's go back now to when we were talking about at the beginning, how long do I really keep a study? How long do I really, should I really keep the regulatory documents needs to be maintained? And verbatim from the regulation, we're going to say, I'm going to read this quote to you. It's going to be 2 years after a marketing application is approved for the drug, or if an application is not approved for the drug, until 2 years after the shipment and delivery of the drug for investigational use is discontinued and the FDA has been notified. So then again, back to the slide we had in the beginning, after 25 years, how long do you really keep those documents? Check with your sponsor. If your sponsor says 15 years, but according to 21 CRFF 31257, it says 2 years, then there's a big difference. And who's going to pay for that storage? And which one do I go by? You must go by the most stringent. And the rule is, if one is more stringent than the other, you must go by the one that's the most stringent. So if your sponsor is telling you that you have to keep those records for 15 years, then make sure that you keep those records for 15 years. But also, according, you have a section on budgeting. If you know that you have to keep those records for 15 years, make sure that you include that in your cost and in your budget so that they're paying for your storage for those extra years that you need to keep those. Okay, so I tried to find one here that was had cobwebs and everything on it that could tell you how long that you really did keep it, but I couldn't find one. So again, the key take-home point is, when in doubt, ask your sponsor. Look at your protocol, or look at your MOP, your manual of procedures, or your protocol, and to find out how long that they want you to keep them. Okay, so just to recap, today we have discussed what are the regulatory documents required to conduct a clinical trial. We have also discussed what are the sources requiring regulatory documents. ICH GCP Essential Documents at Chapter 8. Key take-home point, if nothing else, make sure that you look at that and you've become familiar with that. And also remember, on the slide I stopped and said make sure you write this link down. So go to that link and look at it and look around on that when you have a few minutes, and take your time and look at it and see. And those of you that are seasoned, have done this before, maybe you'll look at some more things and say, well, that's why we do that, or that's why they did that. So it's some good stuff even for your seasoned people here that can go back and relook at some of these documents. So if I have any questions, I know I can't take questions, but I wanted to share my email address with you. And if there's anything that I can help you with, please let me know, and I'll be glad to help you. And also, I just wanted to let you know that for those of you that are wondering about regulatory documents and where to keep them, like where do you keep them in your project notebook during the course of the study, we have an awesome project notebook that we provide to all of our study sites at the beginning of the study, and it's designed to tell them exactly where to put their documents so that it's organized in a fashion so that when the monitor comes out and looks at it, everything's organized. And appearing to be organized during the course of the study is half the battle. So if you have everything that's in a file cabinet and just say, okay, well, there's all of my stuff, then you're going to be looked at a little harder. But if you're organized, and if you keep it organized from the first day of your study throughout the end of the study, then you're not going to have any trouble. When the monitors come out, it wouldn't matter because you've got everything all organized. So one of the key things to doing your regulatory documents is to be organized. So if you would like to have a copy of our project notebook, I'll be glad to share that with you. So just shoot me an email, and I can send it to you electronically, and you can look at it, and maybe it might be able to help you out at your site. So if you, again, I'd like to thank you, and have a nice day.